Hello, everybody. Good evening. My name is Tal. I'm the Educational Director at the American Academy of Functional Health. And I want to welcome you to our Functional Solutions podcast, where we discuss about all things functional, nutritional, and herbal medicine. With me, we have Dr. Chill.
Hey, everybody. Welcome.
And as usual, we invited Dr. Chill to share his years of clinical experience as a functional medicine physician, to share with us what works, what doesn't work, and what are some of the clinical studies are showing us, so we can learn and better serve our communities. So it's wonderful to have you here, and we're very, very excited about today's topic, which is probiotics for chronic pain and inflammation. So we know that probiotics are very, very important. They're one of the most powerful treatment tools that we have in the nutritional medicine approach. So in today's discussion, we got some really interesting studies that we're going to review with you, and we also like to always keep focus on the clinical application, not just talking about theory and pathophysiological pathways, but also talk about what are some of the clinical applications you can already take from our 1 hour discussion today to help those in your community or family or friends or relatives that would need such anti-inflammatory support. So today we're going to talk about what are probiotics, what are prebiotics, what are synbiotics, and what are the differences between them. And then we're going to go into some of the really interesting mechanisms. We're going to dive a little bit deeper into functional medicine and how does probiotic impact our gut ecosystem, and how does that changes our levels of inflammation or function of the immune system. And of course, we're going to finish with some practical, professional grade, we call them nutraceuticals, supplements that your patients could benefit from. So as we know, chronic pain is a big, big topic. And according to the International Association for Study of Pain, there are nearly about 50 million Americans, million US adults, Americans, that are experiencing chronic pain on most days. And about 1 out of 10 adults suffer from chronic pain on a daily basis. So as healthcare practitioners, learning how to identify the root cause of chronic pain and inflammation is one of the most important things that we can do to benefit our community. While this pain can be experienced in the back, hips, very commonly in the knees, eventually leading to degenerative conditions such as osteoarthritis. There are some similarities in the mechanism, and we're going to talk about this. And of course, we define chronic pain as a pain that is lasting for more than 3 to 6 months. Dr. Chill, can you share a little bit about chronic pain from the functional medicine approach versus the mainstream approach from your experience?
Yes. So the functional medicine approach is really looking at the whole picture, right? What is going on with the patient from all the different types of organ systems? What can be triggering that pain for that patient? And then how can you alleviate those triggers for them? Because there could be other underlying factors that are aggravating the pain or exacerbating it or triggering it, right? And we're going to go into that and kind of dive into that for you and give you some different approaches that you'll be able to utilize for your patients right away. That's more of the functional medicine approach. Usually in the conventional approach, what occurs is you may have done this, right? You're going to go into the doctor. You say, I have a pain here. It's been lasting for 4 months. I don't know what to do with it. They're going to give you a NSAID, some Tylenol, some aspirin, even steroids, or they might give you a steroid injection. So it's going to be more on the medication. And what they're doing is really more hiding the symptomatology behind the chronic pain versus trying to look at the underlying factors that may be triggering it for you or exacerbating it for you. And what we're trying to do in a functional medicine approach is look at those different triggers, address them, and that is going to help us address some of the root causes of chronic pain as well.
Beautiful. And that is a really great way to look at the differences. So because we have so many primary care practitioners in our community that are joining every year. And just last year, we had close to 200 new practitioners that have joined the community at the American Academy of Functional Health. And many of them are primary care practitioners. And one of the most important things to understand when they first reach out to us in the kind of like the discovery phase, if we can call it that, they hear that there's a different approach, right? And as Dr. Chill was mentioning, the difference is really both functional and primary care are needed for patients who are struggling with chronic conditions. But as Dr. Chill were mentioning, the primary care approach is focused more on managing the conditions and the symptoms, while on the other side, functional medicine, we look more into the root cause of those conditions and how we can optimize, remove the triggers as much as possible and support healthy function using nutritional medicine, herbal medicine, phytonutrients that are specific, right? So we have all these different tools in our toolbox that can help to facilitate healthy function, right? And we know that unfortunately with pharmaceuticals, while they are needed to manage the patient condition, most pharmaceuticals are not designed to improve the patient's health. And that's one of the reasons why we see patients starting on 1 or 2 or 3 medications. 10 years later, they're on 7, 10, 12 medications, and they're just, unfortunately, many of them continue to progress. So what you're learning here is very valuable for chronic patients. So let's dive into it. Dr. Chill, take us into probiotics. What are probiotics? How are they used?
Absolutely. So as Dr. Cohen was mentioning, we are discussing probiotics for chronic pain and inflammation. Before we get into like the mechanisms of all that, let's just kind of dive into what probiotics are, right? And then actually the differences between probiotics, prebiotics, and synbiotics. A lot of people understand what probiotics are, but not a lot of people know what prebiotics or synbiotics are. And I also want to kind of dive into the specifics of probiotics a little bit more and how it relates to inflammation and then chronic pain for your patients. So let's just dive right in here. Probiotics are live beneficial microorganisms. These are meant to support healthy metabolic function. And this is when you consume probiotics or it's applied to the body. Many of these microorganisms in probiotic products are the same as or similar to the microorganisms that are naturally live in your bodies. So those were what probiotics are. Those are the live beneficial microorganisms that are usually in our microbiome or in our bodies. Some of the strains include Saccharomyces, Lactobacillus, Bifidobacterium. Those are some regular ones that you might see and hear of often. Those are the ones that are going to be the most studied, and we'll actually dive into some of those strains for chronic pain as well. And what's important about these strains is It's the right strains of probiotics that can support healthy digestion, regulating immune function, reducing allergic reactions, preventing overgrowth of pathogenic bacteria or infections, modulating your immune system, modulating your inflammation and your chronic inflammation. That's why we are talking about probiotics. It's for that inflammatory phase. Now, prebiotics, on the other hand, these are what feeds your probiotics. Again, the probiotics are your live microorganisms. What can we use to feed them to help these good bacteria or these great microbes to grow even more and to help your body even more? It is through prebiotics. These are the non-digestible fibers that selectively stimulate the growth or activity of the desirable microorganisms. Inulin is an example of a prebiotic. So when you buy a probiotic or a probiotic package, if you read the back of the label, if it has inulin or fructooligosaccharides, which is FOS, or galactooligosaccharides, which is GOS, these are all forms of prebiotics. And sometimes the packaging or the supplement will contain both a prebiotic and a probiotic. Now, some vegetables that are high in prebiotics, you can also just order some probiotics without the prebiotics, but then you can get the prebiotics through food. Some examples of these are onions, garlic, Jerusalem artichoke, asparagus, bananas, oats. These are all high in fiber, and it's that fiber content. It's the inulin that is in the fiber that is considered the prebiotic, or it's the beta glucan that is in the fiber that is the prebiotic. Again, feeding those healthy microorganisms, which are the probiotics. These can also contain things such as butyrate or short-chain fatty acids, which are also beneficial for the gut bacteria. Synbiotics, these are the products that I was speaking about that combines probiotics and prebiotics. So essentially what you're doing is you're introducing a healthy microbiome or trying to balance that out with these healthy microbes or the probiotics. And then it has the prebiotics such as the inulin, the FOS, or the GOS that has it as well to feed those probiotics to kind of get more effect from the probiotics. A great example of a natural symbiotic is breast milk. This is actually optimal food for infants and toddlers because they contain both the probiotics, such as lactobacillus, which I mentioned earlier, along with the bifidobacteria, and then the prebiotic human milk oligosaccharides, because that's the complex carbohydrates that I was talking about earlier as well. And this was done through a study called lactobacillus bacteria in breast milk. And that was published in the Nutrients Journal in 2020. What's interesting that I mentioned, what's interesting about this and what's interesting is to mention that mothers who receive antibiotherapy during pregnancy or lactation, they had a significantly lower amount of beneficial bacteria in their breast milk than other mothers. So this is something to consider. And then other factors to consider are dietary habits, environmental exposure, social conditions, and then the impact on the amount of probiotics in the mother's milk.
Absolutely. So now that we have a better understanding of what are the differences between probiotic, prebiotic, and synbiotics, essentially each one of them has their own unique role in the patient's treatment plan. We can see that probiotics will introduce those beneficial bacteria that can have physiological positive impact. As Dr. Chill mentioned, prebiotic will feed those beneficial bacteria. And then we have the synbiotic when you want to give the patient both, right? Of course, there are more specific indications or contraindications to those, and we dive much more in depth into those in the the Advanced in Clinical Functional Medicine program, in the GI modules. They are very comprehensive. But if you are thinking about having your patients start on those, in general, we'll have some great recommendation and supplements that are professional grade at the end of this discussion. And then if you are just starting with prebiotics, typically 2 to 3 grams per day is a good starting point to consider, and then increasing it very, very slowly. For example, if you take inulin, 2 to 3 grams per day, you can mix it with some water or juice, drink it slowly, and then every 2 weeks you can increase by 1 or 2 grams. And of course, some practitioners will go straight to the 5 to 10 grams. Some patients might experience bloating. It's something that's important to know because you're now feeding those bacteria and they ferment those fibers and they're growing in quantity. So that's something to be aware of. That's why for most patients, it is better to start increasing slowly. The synbiotic products have typically smaller amounts of prebiotic fiber, and they mostly focus on the beneficial probiotics. So they're more balanced products with significantly lower amount of prebiotic. Typically, could be between 20 milligrams to 100 milligrams per dosage. So now that we understand the differences, thanks to Dr. Chill to explaining to us how each of those work. Now we're gonna talk about what is the benefit of probiotics in reducing inflammation. And so there are multiple studies that have been coming out to give us more and more clarity about this connection between gut and inflammation. And we know that there are trillions of bacteria in our gut, and they produce different signaling molecules, such as neurotransmitters, right? For example, 90% of the serotonin in our body is actually made in our gut. And unfortunately, with some patients, due to dietary choices, due to stress, due to taking certain types of medication, such as antibiotics or NSAIDs, they can shift the balance in their gut and lead to an overgrowth of dysbiotic bacteria, which are considered to be either imbalanced bacteria or sometimes we call them pathogenic bacteria. And the problem with that type of imbalance is that, one, you either have too many harmful bacteria, or two, a different situation that we see very often is it's not that you have more of the harmful pathogen or pathogenic bacteria, it's just that you don't have enough of the beneficial bacteria, right? And so that's a state of imbalance, as we call it, dysbiosis. And that can lead to all sorts of trouble. It could lead to interfere with the neurotransmitter synthesis, trigger neuroinflammation. It can impact the gut-brain axis. It could negatively impact our nervous system. And when we talk in more specifically about the gut joint axis, there's a really interesting picture that I wanted to share with you guys. This is from a study published in 2020. It's called The Role of Physical Exercise on Gut Microbiota Modulation in Older People with Osteoarthritis. And what we're seeing here essentially is you can see how physical exercise, diet, and probiotics can have a significant impact on inflammaging. We have a whole class on inflammaging. We have a whole class that we talk about on how the gut impact weight gain and obesity, and then of course leading to gut dysbiosis, right? So if the patient is not consuming sufficient amount of fiber, right, we're not supporting the beneficial gut bacteria. So in some patients, you can see a significant reduction in a healthy gut microbiome because they're eating fast food. For example, that's just one example, right? So unfortunately, gut dysbiosis could increase the risk of intestinal permeability or increased intestinal permeability, what some of you may have heard of as leaky gut. And that leads to the production of the transition of lipopolysaccharides into the bloodstream, where it's caused endotoxemia. So those changes in the microbiome composition would impact the immune function. It's of course going to be different with different patients, depending on their genetic predisposition and other factors. But it puts them in a very pro-inflammatory situation. And there are multiple ways we can look at this, but essentially, once the tight junction is opening, right, that's what's called the increased intestinal permeability, the lipopolysaccharides, right, those are bacterial, those are essentially molecules that are found in the outer layer of the bacteria. They transition into the bloodstream where they engage with the immune system, and the immune system triggers a very strong reaction that leads to an systemic inflammation. That can aggravate, of course, multiple organs, but in more specifically for our conversation today, it could increase the inflammation that occurs in the joints and will have a very negative impact on it. There are also recent findings in another report, the Current Rheumatology report that was published just recently, 2023, that stated that trauma, lifestyle, right, the well-known factors, trauma, excess weight, metabolic diseases, and chronic antibiotic treatment can disrupt not just impact the trauma, and overweight will impact the joints, but it can also, that and antibiotics can also disrupt the commensal homeostasis in our gut microbiome. And that leads to impact, again, our intestinal integrity, promote the leakage of those bacteria, endotoxins, and metabolites such as lipopolysaccharides that we have just discussed in. And of course, there is an association between the increase of lipopolysaccharides and the severity of knee osteoporosis and chronic pain. And it is LPS, so lipopolysaccharides, is a classic activator, is a very strong activator of the innate immune system that activates the different immune cells, such as macrophages, neutrophils, in the host. And they do that by binding to the TLR4 complex. Now, very interestingly, there are some animal studies that have shown that once you introduce higher quantities of LPS, lipopolysaccharides, you have a very strong immune activation that involves the innate immune cells. And to kind of conclude this mechanism, I wanted to show you another really interesting picture that kind of encapsulates the connection between how the changes in our gut, you can see on the left side, and what happens when we have a dysbiosis, or your patients maybe have elevated inflammatory markers in the gut. There are specific lab tests that can test all these biomarkers. You just have to learn how to read those biomarkers, kind of like reading a map and navigating things, right? Kind of like a detective that try to look at the clues and the data to understand what we need to focus on first, right? Is it fixing the gut integrity? Is it removing pathogenic bacteria? Is it fixing the problems of metabolites? For example, there's not enough of the short chain fatty acids that those bacteria produce, right? Those have anti-inflammatory impact. But on the left side here in this picture, you can see the leaky gut. Essentially, we got those particles, those bacterial toxins leaking into the blood when we encounter an immune reaction that starts to signal to the body that we have what we call a chronic low-grade inflammation, right? It's in most cases the patients they're not gonna know that they have leaky gut, but their symptoms over time very slowly could increase, right? And that of course leads to pro-inflammatory cytokines and continuous destruction of the joints. So on top, you can see the gut dysbiosis as a major contributor to leaky gut. It also reduces the short chain fatty acid, and it also reduces the Tregs. So all of you, as you're going through the advanced functional medicine, you're going to learn about functional immunology and the importance of regulatory cells that have an anti-inflammatory. They modulate the immune system. So if you have less of them, you're more in a pro-inflammatory situation, right? If you have on the left side and the top, you can see TNF, tumor necrosis factor, and interleukin 1, interleukin 6. When those increase, then they are associated with joint pain and also neuropathy. So it's important to know that our gut can impact so many parts in our body. And on the bottom, we can see the 3 factors that contribute that are factors that contribute to positive physiological changes. So Mediterranean diet, high in fiber, high in phytonutrients, right, helps to mitigate some of that. Physical activity, so it supports healthy intestinal mucosal immunity, and also increase short-chain fatty acid production, which is anti-inflammatory. And then probiotics, when we talked about it, are supporting healthier gut homeostasis, right? By introducing those beneficial bacteria. So you can find, if you want interested in reading more about this, of course, any of you are in our functional medicine program, you're gonna go through a very detailed classes on how to detect it, what specific treatment protocols for each one of those, and that's something we dive in much more in detail. And Dr. Chill, share with us a little bit about what's happening on the other hand of it, and any other comments you might want to add to this.
Yeah, absolutely. So the LPS, as Dr. Cohen was mentioning, is really important. The reason why we want to kind of go into this mechanism of action with you is because when you look through this information, right, you see the LPS, you see the intestinal permeability, you see the decrease in tight junctions. All of this can actually be tested for your patients. So this is just another option for you to investigate what is going on with their inflammatory processes that are aggravating their pain or leading to the chronic pain that they're experiencing. And what I have done actually in my clinic is, when I had my clinic in Arizona, one of my main focuses was chronic pain. And so with chronic pain, I was actually doing a lot of prolotherapy, which is just injections of nutrients to help to restabilize the joints. What I found with those patients is that when I started to look into their gut health, I was seeing that there were imbalances in gut health. And when I tested them, I would often see that they had some sort of intestinal permeability or leaky gut. And I was seeing LPS increased with these patients. So what I did was I addressed their microbiome and I improved their intestinal permeability. And what I found was that the effectiveness of the prolotherapy injections increase. So that meant I actually had to do less injections for them. So when I would see patients maybe every 3 months or even every month for the injections, it decreased to every 6 months to even every year once I addressed some of the intestinal permeability, the immune responses, the inflammation that was going on internally as well. And then this allowed their joints to heal properly, and it allowed them to have decreases in the injection therapy that was meant to decrease their pain and also improve their joint stability. So it's really important to look at these underlying factors. And this is the main reason why we're going through the mechanisms with you, so you understand these underlying factors and the importance of them, and how we look at that from a functional medicine standpoint, and how we can actually test it for our patients.
Yes, absolutely. And thanks for clarifying that. It's we had very similar experience in our practice where patients would come get the IV infusions of nutrients, nutritional medicine, or regenerative medicine injections. We had the same exact, or maybe they would come in for acupuncture or other different services. We would always have them start with the functional medicine sort of evaluation, because like you mentioned, addressing the root cause is so important. Everything else we do are tools that we can add on to facilitate the healing process, right? But this is why it's so important. And if any of you are, as you listening to us, you think like, wow, this is like there's something I didn't understand, or there's a lot here. Like, don't worry, we break this down in detail, and we take you through it, the whole process in the functional medicine program. So as you go through the advanced program, we're gonna build up your knowledge base, like step by step, and in a very logical way. So we're gonna continue with kind of concluding this section on mechanism, and then going into what are the supplements that your patients can use when they're struggling with chronic pain. And before that, I just want to share another interesting picture about how, on one hand, we got the gut joint axis that can lead to more inflammation and aggravating the damage to the cartilage. But on the other hand, when you have damage to the cartilage, it could lead to the activation of the innate immune system, and that inflammation might continue to also impact the gut. And in this particular interesting picture that you're seeing right now, you can see that when you have damage, or when you have higher amounts of reactive oxygen species, what we call other term is free radical, you will have the release of damage-associated molecular pattern, and then activation of the pattern recognition receptors, and all the way to an immune response. So it's those expression of inflammatory mediators and additional cytokines and inhibition of collagen formation. So really interesting that it's a vicious cycle, and essentially many of those patients they're locked in this vicious cycle in which either their diet, certain medication, there are different environmental factors. There are multiple factors that can negatively shift their gut microbiome towards dysbiosis, leading to inflammation. That inflammation leads to joint damage, contribute to joint damage. That joint damage, again, contribute to more inflammation. So it's a vicious cycle. And of course, we have specific module on training on how to stop that cycle, how to get them out, and by addressing the gut. And then what are the specific treatment protocols that they can use for joint pain, specifically like collagen, type 2 collagen, for example. There's also specific nutraceuticals and herbal compounds that can inhibit some of those cytokines and inflammatory enzymes. So that's something, of course, we're not going to discuss today, but that's something that is very important, not just to learn functional medicine, but specifically how to restore healthier function of the joints when you are seeing patients with really ongoing inflammation, like arthritis or osteoarthritis that causes damage to the joint. But essentially, for today's discussion, remember that probiotics can help to establish gut health and healthier microbiome composition. Here's another really interesting chart that I wanted to share with you guys. This is from a published study in 2023, December of 2023. So just recently. And in this particular study, they kind of summarized the interesting studies, and you can see above Lactobacillus casei shirota, that was actually found to reduce serum levels of high sensitive CRP. And you can see underneath in the study, and it was reduction obviously in pain score. And then on a study on the bottom, this is on the report on the bottom, or which is just a case report, right? We typically like to see more of the randomized control trial, like the study on top with 461 patients with knee osteoarthritis. So now that gives us the double-blind studies, randomized, give us much more, let's say, better, higher quality of data. But it's interesting to mention that some case reports show that Lactobacillus rhamnosus is great for reduction of inflammation and pain, mostly because Lactobacillus rhamnosus is really helpful with closing the tight junctions, right? Making sure that we have a better function of the tight junction in the gut. So that's something, and we'll post here the name of the study, so you can, if you're interested, you can take a snapshot of this with your phone, and you can also look for the particular study and read more about this. And so here's another interesting study. So kind of summarize the three factors that contribute to healthy gut microbiome balance, and what are the factors that how is gut health, what can other conditions can gut health lead to. So let's take a look at the next picture. This is from another interesting published study. It's called The Gut Microbiome, a New Frontier in Musculoskeletal Research. This was published in the Journal of Current Osteoporosis in 2021. And on the top, you can see the important factors. So from the left side, you want to make sure that your patients are eating sufficient amount of fiber. That's so important. They can add fiber as a supplement. They can increase the amounts of vegetables and fruits. And you got to think about it, like how many of us actually get 5 to 7 servings of fruits and vegetables every day, right? If you think about it, that's not many of us. Even patients that I had that were vegetarians, right? Some of them don't get that amount of fruits and vegetables. And this is where supplements could be helpful. Of course, the Mediterranean is big in terms of fruits and vegetables and fiber. And then we also have exercise is important. And then on the right side, we got the pre and probiotics, right? And those help to sustain a healthier gut microbiome. And unhealthy gut microbiome, as we mentioned, leads to immune system activation that can have a very harmful impact long-term on our joints. And on the right side, bottom right side, it can also lead to glucose dysfunction, glucose imbalance, right? And sarcopenia, or weak or low muscle mass, right? So just remember that. And here's again, the name of the study. So you can, if you're interested in reading more about it, you can feel free to grab your phone and take a snapshot of this. And so this is where we get to an important part of our discussion, which is, we talked about the clinical application, we talked about some of the mechanisms, and now you understand how it's all connected, how it works, and you can explain to your patient what are the steps that they need to take, right? So this is where we get to a very, very important part, which is what type of nutraceuticals can your patients use? So Dr. Chill, take us through how to identify a good probiotic brand. I know that there's, in so many cases, we just don't want our patients to buy off the shelf, like Walmart, Walgreens,
Right.
GNC. There was a report in New York that picked up supplements from from the shelves of some of these stores, and they showed obviously that there was no what was on the label did not match what was in the capsule, which is not a good thing. So
And
we want professional grade. So Dr. Chill, take us through that.
absolutely. And that's the reason why you might have patients that have been like, I tried a probiotic, it didn't work. I tried that supplement, it didn't work. And then you ask them, where did they get it? And oftentimes it might be one of these stores that Dr. Cohen was mentioning. And as he was saying, there is a lot of research that's showing that a lot of the products that are out in those over-the-counter type places or the over-the-counter type stores, it's not actually the product. So it is not going to affect your patients in any beneficial way. And so we wanted to take the time to go into how you can address or assess what probiotics are actually good and how to actually identify a good probiotic brand. Typically, what practitioners will do is we will look for at least 10 to 25 billion CFUs in the probiotic, and that the products are third party independently researched. So, some considerations for testing include testing for contaminants such as heavy metals, molds, pesticides, or insecticides, making sure that the label is containing what it is actually listing, and that every batch is standardized, and that every ingredient that is in there is showing what is on the label, and that it doesn't contain any undeclared ingredients. So how can we get a good probiotic or a great supplement? There are some companies that many practitioners will work with, and one of the companies is going to be Emerson Ecologics. And this is a company that many practitioners will use because they actually house and distributes many of the high quality professional grade supplement brands that we often use. And we often use these brands because they have been third party independently tested. Every ingredient that is in that bottle has been tested and been shown to be clinically effective. And we know that they are getting the actual ingredients that are in the bottles or the packaging. Emerson Ecologics also has a standardization that is requiring that all the distributed brands undergo a quality assessment. And then they actually have a quality standard that goes beyond that with EQP. And this is going to invite the brands to have a confidential manufacturing process, quality assessment that the Emerson team will actually carefully and comprehensively evaluate for them. And then depending on their quality practices, the brands will either qualify for an EQP silver or an EQP gold partner level. So when you go to Emerson Ecologics and you order this for your patients or have your patients order this, they're going to see a seal that's going to either be silver or gold. And that is going to determine the quality practices that those manufacturers or those brands will have as well. Now that is stated and you understand how to look for good quality supplements, and in particular good quality probiotics and what companies to go for, let's go into some of the probiotics that you can use specifically for joint health and your patients. And now that you understand the mechanisms of action behind the triggering effects or the underlying factors that can exaggerate or exacerbate the joint inflammation or chronic pain for your patients, and you understand that there are gut health implications in this or microbiome implications in this, what we can do is use probiotics as a tool to balance out the microbiome, to also help with the intestinal permeability, to also help with decreasing the LPS that has been shown to increase the immune activation and the pro-inflammatory cytokines with that immune activation that is triggering joint pain or triggering joint destruction, such as in osteoarthritis or other inflammatory conditions. Probiotics will be extremely beneficial for that. One probiotic that you can use is called Green First Original Pro. That's a mouthful. It is Green First Original Pro, which is listed right there, and that's by Greens First. What they have is they've contained ingredients such as the beta glucan, which I was mentioning earlier, which is a prebiotic that is going to help feed the probiotics. They also have patented oat fiber. It is also going to contain over 54 different superfoods, extracts, concentrates, including super greens, vegetables, fruits, and then the probiotics that I was mentioning, soluble fiber, some herbs, some spices, some flavonoids, some enzymes, and some lecithin. These are all meant to work synergistically with these probiotics, such as the Lactobacillus casei, which Dr. Cohen was mentioning in the studies, along with Lactobacillus rhamnosus, that was shown to help improve osteoarthritis. That is a great probiotic that also has other ingredients such as greens and fibers and flavonoids that will help increase the effectiveness of the probiotics and to also help to increase the impact on the joint health for your patients. And Lactobacillus rhamnosus, we know, is great for reducing inflammation and increasing the anti-inflammatory cytokines interleukin 10. And we saw that in the study that Dr. Cohen mentioned earlier. And if you want to read another study on this probiotic, you can go to the study called oral administration of Lactobacillus rhamnosus, which ameliorates the progression of osteoarthritis by inhibiting joint pain and inflammation. And this was published in the Cells Journal in 2021. Another probiotic that you can consider for your patient is called Probiotics Colon Care. And this is the shelf-stable version, which means it doesn't need to be refrigerated. And this is by Garden of Life. The raw probiotics that is in here, they are going to offer all of the benefits of a true food probiotic, including 30 plus strains of probiotic, including all of the strains that were mentioned in the studies by Dr. Cohen. So those include the Lactobacillus casei, the Streptococcus thermophilus, the Lactobacillus rhamnosus, the Saccharomyces cerevisiae, the Bifidobacterium animalis. It contains all of those microbes and those probiotics that have been shown to improve inflammation and decrease osteoarthritis and decrease pain in chronic pain patients. And that is a great probiotic to consider for your patients as well. Another probiotic that we want to mention is Therabiotic Biota Gen by Claire Labs. This is great because this is actually the soluble dietary fiber with the prebiotic activities. This is going to stimulate the growth of the colonic populations of beneficial bacteria. And this is also going to enhance the gastrointestinal and systemic immune function. And it's also going to contain a specific probiotic, the Saccharomyces cerevisiae, which has been shown to reduce the inflammation for your patients as well. So what I typically do with my probiotics and with my patients is I will typically start with one probiotic, have them finish that probiotic, and then go to a different brand in a different company and a different type of probiotic for them. So we gave you 3 different options to use for your patients. So you can do something like start with the greens first, right? Because this is going to have all of the other components that are synergistic with the probiotics as well. And then once they're finished with the greens first, they can go into the raw probiotics that is shelf stable. So this is going to contain the 30 plus probiotics. After they're completed with that, then you can go into the therabiotic, which is really just the prebiotic. Now that you've kind of replenished their microbiome with all of this healthy microbes, then what you want to do is help feed it with the Therabiotic Biota Gen by Claire Labs that I mentioned as the 3rd supplement for your patients. So that's just kind of an approach that I would typically do with my patients for either helping with their gut health, their inflammation, or their joint pain. And this seemed to work really well for them.
Wonderful. Thank you for those recommendations, Dr. Chill. So now you have we have 3 different types of gut support products that are all professional grade and can help patients when they are struggling with those conditions. As we mentioned, each one of those, when we look into which probiotics we want to pick for our patients, we want to make sure that we pick research-based probiotics that were found to be safe and effective for specifically the conditions that we want to target. And in this case is, of course, reducing the inflammatory cytokines, inhibiting some of the inflammatory pathways, and through supporting healthier gut microbiome. And so that's what we're doing exactly with those products. One thing really interesting to mention that we've seen some remarkable results with probiotics, prebiotics, synbiotics, and they're great as supportive therapies for different conditions. They have lower interactivity or synergistic impact with medication, and so they have a much safer therapeutical profile. And one thing that I will mention that is important to remember is that when we take probiotics, we're essentially introducing into our gut species, probiotic species, bacterial species that are beneficial, that some have unfortunately either we no longer carry, and some of them could be in lower quantities, and it's almost like we're getting the reserves into the military, right, to help to boost up the amount of good soldiers that we have, or good the folks that help our gut to function better. However, probiotics colonize the gut temporarily, which means that once the patients stop taking the probiotic, they might not all probiotic can establish residency in our gut, right? So unfortunately, once we stop taking most of those probiotic, we'll move out with the bowel movement. And so just remember that for that reason, we see them as very supportive tools, but we also have to work on all the root causes, the patient's diet, their environment, lifestyle factors, making sure that they're eating according to what's happening in their gut. If there's any other causes for inflammation, and typically there are, then we want to address them, because we don't want the patient feel better. They stop taking the probiotic and the pain, the inflammation comes back, right? So remember, we want to address the gut, we want to reduce the inflammation, and we look at the other root causes in the patients. Kind of like Dr. Chill said, we look at the whole picture, right? That's what we love doing in functional medicine. It's like looking at where the patient is, where the patient currently is struggling, where the patient was previously when they were healthy, and what happened in the middle, right? That's what we do in functional medicine. And then we add the health optimization. So we love to talk about health optimization. And unfortunately, that's something that most schools, and I went through 3 different functional medicine programs, most schools don't talk about health optimization. They talk about the root cause, but there's no additional health optimization, which is very, very important because one, we want to make sure that the patient keeps on getting better, right? They keep improving, working towards better and better function. And that's something that we used to tell our patients all the time. If we do our job well as detectives of figuring out what's causing the dysfunction, and you follow our instructions to the best of your ability, then the end result is that you won't need us anymore. We'll educate you and we'll be glad to see you once in a while for a check-in, but we want to make sure you get to the place in which you are in much better health and you can take care of yourself, right? So Dr. Chill, did you want to add anything to concluding our interesting discussion of probiotics and chronic joint pain?
Actually, you summarize it perfectly. I mean, that's the whole point, is optimizing their health, right? My whole speech, even in the beginning when I'm seeing my patients, is I don't want to see you again after I heal you, right? My job is to educate you and to get you to a good physiological response. After that, we optimize your health. I am going to educate you this entire way so you know everything that is going on step by step. So when we are done, you're going to know exactly what to do to optimize your health, even after you see me.
Exactly. And it's important not just for patients, right? It's not important. It's not just that we want to, it's important for providers to guide their patients through this journey. It's also important for providers to utilize this system, the health optimization system, to keep improving their own health, right? Because it's hard for us to help others when we struggle, right? If we struggle in terms of our health, if we struggle in terms of our finances, or if we struggle in terms of our spirituality, right? It's hard for us to help other people that are struggling. And so for that reason, we have this year, we have introduced the new program, which is Functional Medicine Quick Start, where they work with you, Dr. Chill, to use the evaluation form. They watch the 12 minutes videos, mini lectures, right? 12 minutes. It's just 12 minutes every day on their phone or on the computer for a couple of weeks. And then they go through the evaluation form. They go through the applying the specific, looking at the clinical guide and improving their own health. That's something that is very, very valuable, right? This, in some cases, for some individuals, they might need it more than others. I know that I did. And when I continuously struggled with so many chronic conditions when I was younger, getting out of this situation, understanding the root cause for myself was more valuable than the thousands of dollars that I paid for functional medicine, right? Training, because I was able to live life in a much better quality, right? So, and then give to others, right? So that's what we're here about. We're here to advance our skills and contribute to other people in our community, change their lives. So, Dr. Chill, I appreciate you being here and sharing your experience and clinical experience in putting this together. And also appreciate our media team and Jacob. We're doing a lot of work in the background to bring this to all of us and use the visuals and all of the other things that we're trying to put for you guys. And hopefully this was interesting. you learned a few things. And since we're heading into the holiday here in the United States, 4th of July, we wish everybody happy 4th of July. Enjoy your family, enjoy your friends, and we'll be seeing you next week for some additional interesting discussions that are coming up, and on chronic pain, on fibromyalgia, with case studies and some interesting presentations. And of course, for all our community members, you have access on demand. So you can continue to learn functional medicine at your own pace while you barbecuing outdoor and enjoying 4th of July. So happy holiday, everybody, and take care, and we'll see you next time.